upper respiratory tract infection. Mean say infection wey dey happen to people for the upper part of their respiratory tract. Let me explain. Your respiratory tract, this your nose. Through your nose, you go enter, you go pass through your throat area. You go down, enter your lungs. That be your respiratory tract. So we get the one wey dey for up, we get the one wey dey for down. So when infection happen for the upper part of your respiratory tract, we go talk say you don get upper respiratory tract infection. Now the funny thing be say this infection e dey happen to people well, and then they'll come say, doctor, wetin come dey cause this type of infection? Sometimes or most times this infection dey common towards this time of the year, towards the ending of the year, whether you dey Africa or even abroad. I will explain to you why. Because for those wey dey like Nigeria now, you go notice say the weather don dey dry, like harmattan don dey come. Abi, you understand? Very good. Harmattan don dey come. So when harmattan don dey come, you people go say, doctor, I dey get catarrh, I dey get sore throat, I dey sneeze. So even during this period of cold, some of them dey get catarrh, they get sneezing, they get sore throats. Na this period, so e dey affect the upper part of their respiratory tract. Yes.
Now, this upper respiratory tract infection fit even lead to fit even continue, become lower respiratory tract infection. That is, affect the lungs and the bronchi, all those other part of the respiratory tract infection and respiratory tract. Sorry, but today we just dey concerned about the upper part, and one of the reasons why we really dey concerned about the upper part is because for those of us wey dey Nigeria, even outside the country, we will notice say weather don change. Some places dey very, very windy and all that, and a lot of people they react to weather. So many people they come down with this upper respiratory tract infection. When we they call catarrh, the normal name. When people they sneeze and they bring out catarrh, so many people they come down with or another name we call am common cold. So when people they get all those things, I will say, okay, it is good. May we talk about them today.
So wetin be the symptoms of upper respiratory tract infection? Very common one. Person fit dey cough. You go hear people dey cough. Any small thing, the person come dey sneeze. Remember, dust don dey for this period. Weather don dey dry. So when you waka go anywhere, small thing fit enter your nose, you start to dey sneeze. And then I go mention one more, and I go hand over to Dr. Israel. May he continue. Now, as the person dey cough, the person dey sneeze, sometimes person fit also get sore throat.
Okay, yeah, as Dr. Fred already talked, those are most of the common symptoms. Then for those when they sneeze, you constantly notice say their nose go dey run, the catarrh go dey come from their nose, and also they go dey irritated. Any small thing, they are not their body they do them one kind. They know they feel their self. May I use that word? They know they feel their self because they irritated. Small things go irritate them and all that. Sometimes their body feel on the hot, or they get fever. Some of them go they get headache. And the reason why they get headache now because most of the time mucus don't block all those sinuses. Those sinuses not supposed they block, supposed they free. So when all those sinuses don't they block, sometimes they get headache. You can't be like say that they get malaria. Not be malaria they get, not just upper respiratory tract infection. Another thing you can notice say their throat they very dried, and their throat they dry, and when their throat they dry, so you need say that they cough and many of all those things.
Then why is it that this thing dey happen this period? Weather. But wetin dey cause am gone? Wey be say when we don't get to this time of the year, people go come dey notice say that they cough, they sneeze.
Okay, so when we talk, what did they cause this upper respiratory tract infection? I go just mention some. There are some things when I'll talk, you may not understand. But one, a virus, now they cause them. So that's the most commonest of all, virus. So and then because now virus, most of the time you not really need to take too many drugs. Now some can be bacterial infection and all that, but the major cause of common cold, catarrh, upper respiratory tract infection, virus. Then some can be allergic reaction. We say weather don't change and all that. So sometimes your body can want to respond to these changes when they happen around. And the way of helping us to protect our tract, the breathing, what we dey breathe. Not say as we dey breathe in dust and all those things. Now, for the body to also help us protect our body, our lungs, make dem no get infected, make dirty no go enter our lungs, the body will start to dey produce a lot of mucus. And this mucus wey e dey produce na we dey call catarrh. So you dey all those sneezing
Mm.
na just the body respond to make sure say all those dust wey don enter our body, all those things, our body don sneeze dem, don bring dem comot from our body, so that make we no get too many infection for inside the body. Also, another reason why this thing dey very rampant this period, as we talk, everywhere dey dry, the wind dey blow everywhere. So when one person sneeze, the wind go carry am, because na viral infection, e dey quick spread among people. So once person sneeze, anybody wey dey around am, around 1 millimeter away from the person, or even 5 millimeter, the person fit even get am, if im own immune system not too dey strong. However, as I said, e can be allergic because of the weather. The body is trying to fight, wall off all the everything wey enter, the dust and the dirty, so e produce a lot of mucus. Two, virus na be the major cause of the
Mm.
upper respiratory tract infection. Bacteria can still cause it, and other microorganisms fit still cause am.
E get few things make I add. Now, some people dey, maybe the person no get virus, but e get some kind things wey you fit do wey fit make you come down with this upper respiratory tract infection. Number one, somebody fit carry am give you. Dr. Israel mentioned am. Let's say person get am, the person come sneeze. As the person sneeze now, you dey around that environment, you fit carry am. Maybe the person come sneeze, the sneezing come touch the table, touch the chairs, or even your phone. You can't touch those things. You rub your eyes, you rub your mouth, you fit also get am. Or you dey where dey very crowded. Now people dey go out, they go market, wey they go bus, wey they enter buses and the rest. Even for children, now when pikin dey grow small small, they can play well. So they mix up. So all these things will come make people feel they get am. Another one again, maybe your immune system, like Dr. Israel mentioned, your immune system don't go down. So when these things enter your body, your immune system no go get enough power to help you, protect you, and fight all these things. Is there anything we can do? Maybe when this thing come.
There are some things wey we fit do to prevent, or when somebody don already get this upper respiratory tract infection. Now, one thing you should know, we say na about the major cause na viral infection, and sometimes it can be allergic. So because of those two things, most of the time you no need too many drug, you no need too many medication to say you want to stop am, because na virus, e go almost complete e course, and when e complete e course, e go comot. So the only thing wey we dey do is just to help treat the symptoms, all those symptoms wey e dey bring come. So if your body dey hot, take something to take calm the fever. If you get headache, take something to take reduce am. Then take a lot of fluid, water this period. When you take a lot of water, e go help not only when the person get the problem, also e go also help to prevent the upper respiratory tract infection. So when you take a lot of fluid,
Mm.
water, or any fluid when you like, e go help to prevent upper respiratory tract infection. And also, it's also one part of the thing when you go fit use to treat upper respiratory tract infection. Then if na allergy, you
Mm.
take any allergic medication, e go also help to prevent am. But then let me just mention the vitamin C. Those two go always help
Mm.
you in preventing upper respiratory tract infection. One thing wey you need to know, if you get upper respiratory infection, you no get malaria. Many people dey confuse
Mm.
those two things. Once they just see say they get catarrh, they cough, they'll say na malaria they get. It's two different things. You
Mm.
can have upper respiratory tract infection and you not get malaria. So you no need to come dey
Mm-hmm.
go buy anti-malaria medication, or go dey buy, you say you don get malaria and typhoid, the common word when we for Nigeria people dey always talk, malaria and typhoid. You come buy anti-malaria, antibiotics. All these things go lead to resistance to anti-malaria and antibiotics resistance. So you
Mm.
really don't need them. And also, if your nose come block because of the catarrh, the nose come block, all those things, steaming can also help. When you put your face this hot steam, put small rub inside hot water and cover your face inside so that you inhale it to open the sinuses. That one will help to open all the sinuses. And when you do that, that can also help to reduce the headache as well. And when you do that, it can also help to reduce the headache. So, and when you want sneeze, abeg sneeze am. No hold am for body
Mm.
say no make I no sneeze. When sneeze come, sneeze it out. Because that will also help to free your airway and all that. Dr. Fred, why you dey laugh? So these are some of the things to we can use when we talk about treating and also in a way preventing um upper respiratory tract infection. Also, if you see people wey dey sneeze, dey cough, you better give them face mask make dem wear. You can also put on face mask to this go help for barrier, make person no come sneeze for your body, or make you, if you have it, you wear face mask make you no sneeze for people body. And you cannot take away hand washing away from this
Mm.
period. Hand washing is
Mm.
very, very important because as people dey sneeze, people dey sneeze for anywhere, they can use their two hand to sneeze or sneeze for anywhere, and that same hand they go use am touch the rim wey you go touch, use am shake you, use am touch every part, different place, and you too can actually go and touch those things, and from there you don carry the virus and you can actually take it inside your body. So because of that, hand washing is also very important. You wash your hand with soap and water, or you use hand sanitizer. If you notice say your hand not too dirty, you can use hand sanitizer, and with that you would have saved yourself from coming down with upper respiratory tract infection.